What is it like to get fired as a plant-based doctor?
How do we separate the facts from the fads?
It's like a war of science against the influencers.
Top 5 foods to fix your gut.
You can improve your gut health.
5 tips.
This is how I fix my gut health.
Today we're here with
Angie Sadeghi,
a whole food plant-based gastroenterologist.
Dairy is the biggest junk food sold as health food in this country. Get over it.
Look, if you're trying to get attention, don't blame the vegan diet.
Most people are like, I don't care, I want my burger. Your stupid brain tells you, eat it, eat it, eat it. This is the power of the gut microbiome.
Is vegan poop valuable?
Are you crazy?
Most doctors don't understand nutrition because we're not taught in school.
Is the battle for health lost and won in the gut?
That's a very good question. All we have done is scratch the surface. What you eat is important.
And with that said, welcome to the show, Dr. Sadeghi. How are you?
Thank you. I appreciate you. Thank you for having me. I'm doing great. How about you?
Absolutely brilliant. And it's a pleasure to have you on the show. I'm so excited for this conversation. So in looking into the work that you do and just your whole vibe, you just come across as someone that has really found their place in life. In terms of, well, what I can see, in terms of like the work you're doing, the diet you're eating, the lifestyle you're promoting. How did this all come about?
Good question. Yes, it's true because I live a plant-based lifestyle. I teach a plant-based lifestyle as a physician. And it's really nice to practice what I preach, and be so passionate about something in life and be able to extend that passion and that teaching to my patients to help them reverse disease with the power of plant-based medicine rather than just solely using medications. I was very ill myself, finishing residency and fellowship. I was tired, chronic fatigue. I had eczema. I had high cholesterol, but most of all, I'll tell you, there were the two of these conditions, the eczema and the fatigue, were really profound. I was so tired that sometimes after a 17-mile drive to University of Southern California from where I lived, I would have to take a nap in the car before I could open the door and get out of my car and go to the hospital. Every morning, I had to plan this out where I would drive. I'd be so tired. I'd have to drag myself out of the car. The fatigue was profound. And if I ever sat in front of a computer to do a report, I would fall asleep. So I would take multiple naps. I was exhausted all the time. And I suffered from a condition called eczema, pustulating eczema, which basically looks like you have herpes pustules all over your body. And it's a super itchy condition. And I lived on corticosteroid creams and Benadryl to sleep. I couldn't sleep. I was so itchy. So I started eating a whole food plant-based diet for moral reasons, not even thinking that there were a lot of health benefits to it. And suddenly my health transformed. My energy was through the roof. I couldn't it was like, wow, what happened? It's really weird when you're a tired person and then you can accomplish 10 times or 20 times more than you were able to accomplish, a month prior. It was just pretty profound. And my eczema went away. It turned out that I had a severe dairy allergy, and I'm not alone. Many people have dairy allergy, and we can always talk about that later. As a gastroenterologist, I see a lot of also lactose intolerance. But anyhow, to make a long story short, my health transformed and my body transformed. I was able to enter a fitness competition, which was pretty fun at in my 40s, and I just loved it. It was the best decision of my life.
That's amazing. How did that feel, given that you're in medicine and then suddenly you realize that there's a solution that is related to diet? How was that realization for you?
Profound. We are very well educated in diagnosing disease and treating disease. But, the problem is that even though we learn about lifestyle, like we learn in school that you should always recommend lifestyle modifications to your patients for about 6 months before you stick them on medicines, it's just hard to talk about if you're not living that lifestyle yourself and you don't know how to specifically teach your patients. Meaning, in the books, in med school, you learn teach lifestyle modifications, but I mean, what does that mean exactly? There isn't a huge educational piece to that. So and you and I know that you can't just walk up to someone and say, oh, you know what, you want your cholesterol to go down, you want to lose weight, go on a whole food plant-based diet. Whoa, wait a minute. Like, how, where do I start there? It's not that easy. And what we're missing in the field of medicine is that, we know what to tell them, but we can't really help them get there, because it's a very difficult problem, right? You can't go to the grocery store with the patient. You can't like go into their kitchen and clean up all the cabinets. You can't convince every single person to eat all the same thing. So if I'm seeing a woman in my clinic who's trying to lose weight and reverse heart disease and diabetes, and if I ask her to go on a whole food plant-based diet, that doesn't necessarily mean that she's going to go convince her husband and her children. It is a difficult problem. I'm not saying it's easy, but we can't give up. As physicians, we've got to keep trying, finding out ways. What I have done is I've hired a dietitian. So when I diagnose disease and I treat it, sometimes they have to be on medication. Sometimes they can treat it with lifestyle modifications alone. I have teamed up with talented, very intelligent dietitians to help walk them through. And it's a slow process. Some people miraculously go home, and I've had patients who do it. They just go, fine, I'll do it. And I'm like, are you sure you got, yeah, no problem. And they go home and go on a whole food plant-based diet, and they come back, oh, I'm 10, 20 pounds lighter. Great. But that's not the norm. We have to have ways of teaching people what to do, how to make sure that they're getting all their nutrients from a whole food plant-based diet. So they're not eating junk food vegan, and so that's another whole problem. So anyway, but going back to me, I personally, when I started my journey, I ate a whole food plant-based diet, not junk food, and I was able to do it by myself because I'm a physician. I had knowledge of nutrition. But anyway, it is a problem. And I think that we really need to have podcasts like yours and ways to teach people how to do it, not just prescribe it, but also help them achieve the goal.
I would add to that, though, that it's very significant that you're even prescribing a dietitian, because just to have that option is a game changer. Because whenever I've gone to the doctors, they've only ever prescribed medicine. But the fact that you're offering that as a solution is already, I think, groundbreaking. Even though it shouldn't be, it is.
I have to tell you, though, we have a systemic problem. Medicare, for example, doesn't cover dietitians for weight loss, even though the diabetes and the heart disease could be reversed. Many insurances don't cover it. So it is a luxury. I live in Newport Beach, California, and I have a certain, socioeconomical status that I work with. But many parts of the world, our government doesn't care enough to help people reverse disease. So they don't cover these services, right? So it's a big problem. And we're going to have this problem for a long time until we get insurances to cover these services.
What I find really fascinating about your work, which is a gastroenterology, I think I said it right. What I found interesting about this is, do you feel, is the battle for health lost and won in the gut?
Oh, that's a very good question. Amazing question. So a lot of people say that all health starts in the gut. Well, I don't believe that's 100% true. So you could have genetics, BRCA1 gene mutation for breast cancer and get breast cancer, and you could eat a whole food plant-based diet your whole life. So there are some diseases that you can get regardless of a healthy gut. However, I would say that because the gut is the first place that is exposed to your lifestyle in as far as eating, you are very much likely to cause disease or reverse disease or be able to build a healthy body through diet. Okay, so let me give you an example. Okay, so the gut has a barrier where the inside of the lumen stays completely separate from the vasculature, right? So things cannot just free flow from the gut into the vasculature and circle around, right? Now, in the vasculature, you have red cells, you have white blood cells, and all of that gamut. Now, if pathogens could freely, like let's just say you swallow food, but you're also swallowing pathogens constantly. If the pathogens were able to free flow into the blood vasculature system, you would be in trouble because you would have sepsis and die. So uh, evolution has it. So we have these cells of the gut tightly adhered together through these bonds called tight junctions. So what keeps these tight junctions robustly healthy? Diet has a huge important place in that. What happens is when you're eating a high fiber diet, the tight junctions stay tight, and you don't develop permeability. And when you're eating a terrible diet full of saturated fat, what you're doing is basically poke holes through these tight junctions and create permeability. Have you heard of something called leaky gut?
I have, yeah.
Okay, so leaky gut is what people say, well, that's where disease starts. Why? Because all the pathogens in your gut have free access to the blood vasculature. And then suddenly these pathogens that are swimming around in the blood vessels meet up with your immune system, the lymphocytes. The lymphocytes are like, oh no, you're not allowed here. Sorry, we're going to bring more soldiers and attack you. Right? So that's how you get systemic inflammation. And one thing leads to another. You get inflammation in your body. So
Right.
that's one of the ways, one of the cascades. There are many ways you can get inflammation, but what you eat is important because it's important to keep those tight junctions tight and impermeable. The standard American diet is an example of a diet that can cause gut permeability or leaky gut, and a whole food plant-based diet is an example of a diet that is full of fiber and can cause these tight junctions to stay tight to prevent leaky gut.
I understand. So the reason why I asked that, because there are certain afflictions, like with your skin illness, eczema, that you can change your diet and you can heal them. But the standard American diet, the diet that most people eat, can damage the gut as well. And once the gut is damaged, it's then harder to use a dietary resolution. So how do you work with that? Things like Crohn's disease, irritable bowel syndrome, where you say to people, go on a plant-based diet, and they go, I'm burping or I can't digest it. How do you work with that, given that the gut is what's impaired?
Oh yeah, very slowly. I help them transition very slowly. You can't go someone who's like eating a standard American diet with Crohn's disease. By the way, vegans can get Crohn's disease too. There is a genetic component, but what I'm saying is most people who are eating very unhealthy and they are more prone to inflammatory bowel disease, you can't ask them to go on a whole food plant-based diet overnight because they will have discomfort. And the reason is this, Joe, your gut can be fully ulcerated. Okay, so meaning that the entire mucosa of the gut is fully eroded and the gut microbiome balance is completely messed up, for lack of a better term. So what you have is a poor microbiome balance, an ulcerated mucosa, leaky gut or gut permeability, and then it's not even a matter of what they're eating. Everything they eat is going to bother them. So when people with Crohn's disease and all these serious gut illnesses come in, what I do is I try to slowly transition them to a whole food plant-based diet, because sometimes you have to rebuild that gut microbiome that can ferment those fiber-rich foods. And if you're eating a standard American diet, you don't have the gut microbiome capacity to ferment these types of foods. It's just a little bit harder. So you got to kind of transition into it slowly.
Okay, well, I'm glad you mentioned the gut microbiome, because obviously this has become quite a trendy subject in the last few years. But I still think, based on my own education, that people don't really understand what it is. I'm still amazed. So I read recently that the microbiome is so significant that it actually has more DNA, genetic material in your gut than you do in your cells. If it's so important, why do we treat the gut microbiome as a dustbin? I mean, that's what it feels like.
You know, our bodies were evolved to not die of hunger. The people who are basically were able to put away a lot of food and store it as a fat storage are less likely to die in a famine. So our brain centers crave junk food all the time. They crave sugar, they crave saturated fat, they crave things like cakes and cupcakes that are not really good for you, but they're high calorie, and it is what it is. So and it's very hard to fight that, right? So for example, if you were raised a certain way to eat like that, if you were if you really have a genetically have a really high appetite. So a lot of people inadvertently, now some people know, I mean, you and I know how to treat our gut. Some people have never been educated about how to eat healthy to keep a gut microbiome healthy. But also think about, some people are trying, but unfortunately their hormonal balance are not allowing them to eat healthy. So that's why we have an epidemic of obesity, and we have so much garbage food out there, excuse my language, but like cheese, right? Why would we eat a block of fat for fun, right? So you get all that whey protein, casein protein that people are allergic to. You have all that saturated fat that goes right into your coronaries and gives you coronary artery disease. This is like junk food, but it's like so indoctrinated in our culture to eat cheese on everything, right? Some people know it's bad for them and they still eat it, and it's just because your brain centers, your stupid brain tells you eat it, eat it, eat it. And and even this, if the smart brain tells you, hey, don't eat that, it's just hard, right? So because like you go to restaurants, the restaurants are not built to keep you healthy, they want to make money, so they'll keep putting oil and cheese on your food.
So I agree with you. You've got your reward center, your, let's call it your bad brain saying eat the cheese. You've got your your cognition, your smart brain saying don't eat the cheese. Is the microbiome encouraging you to eat more toxic foods if that's what you've been feeding it previously?
Yes, that's a possibility. I mean, we still need to learn a little bit more about the science is not perfect. However, we know, for example, if you take a obese mice and transplant their gut microbiome in a skinny mice, they can gain weight. Or vice versa. You take a skinny mice, you put their gut microbiome in an obese mice, they can lose weight. Could it be that the gut microbiome was dictating to the smart brain or the stupid brain what to eat? I mean, that's a good question, and we don't know exactly. But, and then the question is also, is the gut microbiome the average of what you've been eating in the last month or the last 10 years or your entire life? Is it because your mom didn't breastfeed you? I mean, who knows? There is so much to learn from the gut microbiome. All we have done is scratch the surface, and we know that it's not a sterile condition in your gut, and that you have 100 trillion gut microbiome producing vitamins, producing neurotransmitters, even feel-good neurotransmitters like serotonin. The majority of serotonin is made in the gut. Perhaps some of these other neurotransmitters, dopamine or norepinephrine. Let's just say you have a microbiome in there producing these neurotransmitters that suppress your appetite, right? Like epinephrine, norepinephrine, and things like that. Well, the person who has a larger population of that type of microbiome would have more appetite control, and someone who has another population of microbiome producing hormones that create hunger. I don't. All of this needs to be determined.
It's a theory, but it's not proven that there is this effect. The microbiome has a significant effect on your appetite, mood, and how you express in the world generally.
We believe that the mood has something to do with the gut microbiome. Okay. I'll tell you what, one of the most common diseases that I see, called IBS, has a lot to do with dysbiosis, meaning an imbalance of gut microbiome, and leaky gut. And those people, about 30% of them have depression and anxiety. So, it's hard to say for sure the gut microbiome are causing the anxiety and depression, or could it be that the anxiety and depression caused the IBS? So all of this still under research.
What is more beneficial for your gut microbiome, a plant-based diet or an animal foods-based diet?
A plant-based diet is more beneficial for the gut microbiome because the main food that feeds the health promoting gut microbiome is fiber, and fiber is not found in animal foods. So the standard American diet, high in cholesterol, saturated fat, full of meat and dairy, offers zero fiber. So unless you're eating plants, you're not getting fiber. Fiber is the food for the gut microbiome to live, to thrive, to ferment, to produce short chain fatty acids, which, by the way, heal the gut and traverse the gut wall and circulate in your body and create health everywhere in your body, from your brain to your kidneys to your muscles. So again, a whole food plant-based diet is so much healthier.
Many things in the body, we often say, if you use it or lose it. Does that apply? Does that apply to our ability to digest fiber? Like if we go on a very high meat, dairy, eggs diet and really low vegetables, do we change our microbiome so that when we try to eat fiber, we lose the ability to digest it?
What we know from research is that if you look at populations like in certain parts of Africa where they eat plant-based and compare that population to, for example, people in St. Louis who are eating a standard American diet, we know that the gut microbiome is very, very different. So we see that the stool of the people eating a plant-based diet have far more microbiome that is health promoting. And we see in the stool of the people eating a standard American diet far more inflammatory biome, right? So if the question is now, okay, well, what if you suddenly give these standard American diet people a bunch of fiber? Do they know how to digest it? We need to still determine that based on science. But there's one thing. If you just ask me as my professional opinion, when I ask these people to eat a whole food plant-based diet, suddenly they can't suddenly switch because they get super bloated, gassy, they have burping, excessive flatulence. Sometimes they get diarrhea, sometimes they get constipation. It could be because they don't have the mechanisms to digest this food or ferment this food, because they're missing that digestive capability, because they don't have the microbiome that is necessary to break down the fiber. So that is something that is possible. But again, I think we need to put that to the test and do some more studies about it to know for sure.
So something you said earlier that I found really fascinating, you said that if they, is it called an implant? If they do a fecal implant from a healthy biome, a lean person's biome, microbiome into an obese person, that they will, or mouse, they will lose weight. Is that, like, how is that even, is that understood? How's that
I know,
even
it's crazy. I know. When I read that research from Harvard, I was like shocked. It's possible, right? But we have never done human studies on this. But it's only in mice, and that has to be probably studied in humans. But let me tell you one of the most incredible stories of my life. So when I was I was practicing in Missouri in a hospital. I had a patient with C. diff colitis, which is a very, very serious infection that can kill you. And this poor patient was basically dying. She was on 3 pressors to keep her blood pressure normal, and she was intubated and exogenously we were helping her breathe because her lungs were failing. Everything was failing, and she was about to die. She had a sepsis with a bacteria, opportunistic bacteria called C. diff. And that is an opportunistic bacteria that comes out in your gut and basically spills poison all over the body. So we did this thing called the gut microbiome transplant. So what we did is, and this is, by the way, over 10 years ago. And back then people were not doing this. I was like among the first people who actually did this. And the chief medical officer of the hospital is like, "Are you crazy?" I'm like, "Just trust me." So we took a healthy volunteer gut microbiome and transplanted that biome into her gut, and literally like several hours later her blood pressure was maintaining, she was coming off the pressors. The next day she was completely fine, breathing on her own. So this is the power of the gut microbiome, and yet people don't appreciate the importance of keeping the biome healthy. They keep popping antibiotics for no good reason. And if you're dying of pyelonephritis or pneumonia, by all means take the antibiotics. But popping antibiotics for a little sinus infection, or I think I'll have a cold, bad idea, right? And there's this new trend where people are doing all kinds of antibiotic treatments for SIBO, treatment of SIBO. Again, It's so detrimental. And instead, I think people should think about preventing disease by keeping a healthy gut, by eating the whole food plant-based diet and avoiding junk foods, avoiding red meat, avoiding, all kinds of saturated fat-rich foods. And I think they're fiber. Is that too much to ask?
No. So this transplant that you was involved in, was that a plant-based microbiome or just one that you considered healthy?
I wish. Because I was the doctor, I wasn't allowed to transplant my own microbiome. But and I was
But
like the only vegan in Missouri at the time. No,
that's
but
really
no, joking aside, I was, I asked a very healthy relative of hers who had zero diseases that we knew of. She was young and she weighed, she was normal weight, right? Athletic. So I found her healthiest relative and we used her microbiome. Now they have pills for it. So there are banks, like there's a bank in Boston that takes vegan volunteers, and they make poop pills
that's
from
so
these
funny.
healthy vegan volunteers.
Is vegan poop valuable?
Absolutely. I bet you
That's
didn't know
so
that.
funny. That's so funny.
I'm not
Okay.
just a doctor, I'm a vegan doctor.
No, that's amazing. That's
So
amazing.
my poop is valuable too.
I think that'd be a good T-shirt.
I think so.
So, what about we often talk about with the microbiome, or just in general, actually, the brain gut connection. So, is the plant-based diet also positive for mental health? Is there any understanding around that, or do you work around that area?
The majority, 90% of the feel good hormone neurotransmitter serotonin is actually made in the gut. So the mood and the gut health are very, very tightly related. One of the studies that I would like to see is if you put people with depression and anxiety and do a randomized control trial on people with depression and anxiety and put them on a plant-based diet, what happens? I mean, that is such an interesting field to
Yeah.
explore. Will they get better? Will their mood get better? So, depression is such a complex disease. It could be due to childhood events, it could be due to genetics, it could be due to diet. I mean, it's a very difficult to diagnose and treat disease. And I'm not saying what you're eating is exactly the reason why you're depressed, and if you just change your diet you're going to be fine and your depression is going to go away. But if you think about it, the neurotransmitter serotonin, for example, is made in the gut, right? So could it possibly be very related to what you're eating? And so if you're eating a healthier diet full of fiber, your gut is healthier, you're producing all these feel-good hormones, could that help your mood? Well, that's something that needs to be determined, but I'm very confident that there's a huge connection, and that's why a lot of psychiatrists are now saying that there is enough evidence to help their patients eat more fiber-rich foods and help them change their lifestyle to help their depression, besides just using medicines.
That makes a lot of sense to me. I definitely feel that. I notice in my own self as a diabetic, when I was eating foods that were more processed, just the blood sugar roller coaster would be very disturbing. And with a lot of fiber in the diet and more digestible and natural sugars, the whole thing is a lot more stable anyway. So there is definitely anecdotal evidence, and I'm sure it would be, as you said, it'd be great to see that research. So let's talk a little bit about the work you do in the Institute of Plant-Based Medicine. So my question is, what is it like to get fired as a plant-based doctor? And and I know you know what I mean, because this is something you've mentioned in the past.
Honestly, it feels so freaking good. I love getting fired as a doctor, and I'll explain. But you know what I mean, because I've mentioned it before, and I'm going to say it again. I love getting fired. What do I mean by that? If you come to me with a disease and I'm able to reverse your disease by teaching you how to eat a whole food plant-based diet, right? And you reverse your diabetes, you reverse your non-alcoholic fatty liver disease, hypertension, and cholesterol, and you come to me and you're like, doctor, you're fired because I feel amazing. Oh, I love that. So that's what I mean by getting fired. I don't mean that, I'm a
Yeah,
jerk to people and they fire me. But yeah, no,
yeah,
it's because
yeah.
I changed their life. And I'm like looking at them going, why do you need to come see me every 3 months? You're okay to come every 6 or 12 months or never, if you keep living this lifestyle. But I mean, I have seen some major transformations, and that's why I called my practice Institute of Plant-Based Medicine. Now, some people think, well, what do you do there? Sell herbs? No. This is a real medical practice. I'm an evidence-based medical doctor. I don't mind medications. Believe me, they save lives. However, you can't just you can just use medicines, but it's not advised. It's not a good idea, because one day you'll wake up and you're on 20 different medicines, and you're just gonna die of the complications of taking too many medicines. So what you need to do is, if you have disease, work with a doctor who can help prescribe a lifestyle where you can reverse these diseases and actually de-escalate therapy. So I would say that I'm the best doctor when it comes to de-escalation of therapy, right? Even if I need to use medicines and lifestyle modifications alone do not suffice, I'm very good at treating it and say, hey, let's get off. Okay, we don't want you to be dependent on this for the rest of your life unless we really have to. But like, for example, a lot of my patients with gastroesophageal reflux come to me and they're like suffering. They can't sleep. They're coughing. They're just basically having heartburn. They can't sleep. And I put them on a PPI, but then I de-escalate therapy because I also prescribe a whole food plant-based diet. And the ones who listen and they're able to lose weight, they're able to eat healthy, they come to me and they're like, yeah, you're right. I'm off my medicine. I'm doing great. And that's success.
See, the reason why I wanted to say that phrase is because when I heard you say that, it really highlighted this approach that you have to the well-being of others, which is completely non-egoic. It's like, how can I get myself out the way as soon as possible? And I love that approach. And I think one of the problems we have in the medical industry, and I hear it from all the doctors, is that there's a kind of underlying fear that if people aren't sick, what am I going to do? Right.
Well, I mean, honestly, Joe, I've never met one of those doctors, to be honest with you. Most of the doctors I know are super ethical and good people, and they really want to help. But, unfortunately, the way that our country is, most people are like, I don't care. I want my burger. Okay. So how do you help people like that? The way I have found my niche is different. I help people who want to be helped. Okay, and that's like, you gotta find people who want, like, if you don't want help, I can't shove it down your throat. I
Absolutely,
could
yeah.
be the best, for example, I could be the best fitness trainer, but if you don't like weightlifting and I only do weightlifting, there's nothing I can do for you. And so I have patients that I fire too. I'm like, listen, if maybe it's not a good match,
Mm,
right?
this is
So
great.
yeah, no, I mean, I really don't want to, honestly, I don't want to sound conceited, but I'm a very busy doctor and I want to help people who want to be helped, right?
Right.
And if they're like, no, I don't want to change my lifestyle, no, I don't want to, and I just put me on 50 medicines, that doesn't work. That's a liability for me, because then I'm going to get sued because they have a medication interaction, right? So it's not a good match. So I think that most doctors either want to help their patients, or they actually try. I'm not saying that all have equal education about nutrition, but we all have a certain amount of education and know how to read randomized controlled trials. So, we should all know a high fiber diet is good for you, right? So there are a few examples of people, doctors who are, they haven't reviewed the literature and they're teaching wrong methods or wrong diets to the patients, and that's pretty criminal. But for the most part, most doctors mean well.
Yeah, I agree with you. I don't think there's a malicious system. I just think that when these systems get to a certain size, they start to take on a more impersonal tone. And that's when you get the pharmaceutical companies doing what they do, which is sell medication.
In the short term, pharmaceutical are a quick fix, but in the
Yeah.
long term, it's not the best choice. But we have a lot of sick people and we have a shortage of doctors, right? So here's what happens. Insurance companies, here's inflation is going up, okay? Right now, after the pandemic, my overhead is twice as much as my overhead was before. Okay. Guess what has happened to the insurance reimbursements? Have they gone up? No, not for the last 10 years. So what's happening is medical reimbursements are not keeping up with inflation. So doctors are making what they made 10 years ago. And so what happens, in order to keep in business, they have to see twice the number of patients to
Wow.
make the same amount of money. And a lot of us have taken a huge pay cut. And I just the other day, 3 GI doctors went out of practice. How is that possible when we have such a shortage of doctors? So what happens is big systems like big hospitals are gobbling up the uh, doctors, and they're providing sick care because the money is in sick care, not healthcare. Do you see what I mean?
Right. Yes, absolutely.
If I
Absolutely.
do an endoscopy on someone in the hospital, I get the hospital gets $6,000 or $7,000. If I do it in my private clinic, I get $120. Do you see what I
Mm.
mean? So the
Wow.
hospitals can afford hiring a bunch of doctors, and they have to see 30, 40, 50 patients a day. Okay, good luck. How am I possibly supposed to talk about nutrition?
Right.
When?
I see what you're saying. It's a difficult system. And what I say to people is that even though the system is like that, we've been blessed with a plant-based diet. So if you don't like the system, there's no much point complaining. Just eat a plant-based diet, and that will help you a long. That will take you a long way.
I agree. I agree. I think people, if they did that, they could help their doctors help them, because the doctor has 10 minutes in the room, 15 minutes in the room. They can't sit there and go, well, let me teach you where fiber comes from. I mean, a lot of people think meat has fiber. A lot of my patients have asked me, does meat have fiber?
Right.
Does meat have
Right.
antioxidants? I mean, you would be surprised how many of my patients and my students don't know where fiber comes from. And it takes time to educate people, and we don't have the time in the clinic. So it's very disappointing that this is what's happening to our country.
So I have a question for you, which is sort of related. Sometimes in the more extreme areas of the plant-based world, people shun medicine completely, but I always think it has a purpose as well. So in your mind, when do you or how do you decide to use medicine over a plant-based solution?
Yeah, and by the way, those vegans are giving us a bad name. Why? Because as doctors, as patients, as anybody, we need to be science based, science, evidence based medicine, right? My opinion means nothing. Okay. I can't teach my opinion to you or anybody else listening to this podcast. Medicines are medicines. Food is food. Food is not medicine. Okay. Food is food. Medicine is medicine, right? You need to eat food to prevent disease and reverse disease.
Right.
But there are people who are dying in this country every day, vegans who come to me and they're like, I don't want to use medicines because they're toxic.
Yeah. Yeah.
Wait, would you rather die? But they're so afraid of
Mm.
using medicines. I mean, I see a lot of vegans who, like, literally, they will refuse the use of medicines, and they want to be natural. And I see a lot of people who are meat eaters who go, okay, I'll go vegan for 6 months. Let's see if my colon cancer shrinks. I'm like, no, 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 no. You don't understand. You need surgery, chemotherapy. There's no question here. We're not bargaining. No, doctor, I heard the whole food plant beside can cure me. I'm going to go on a juice fast. And why don't you do another colonoscopy? I mean, this happened. Can you do another colonoscopy in 6 months? And if the tumor is still there, I'll have surgery. I'm like, you don't understand. Your tumor will be there. Juicing and fasting and a whole food plant beside is not going to take your cancer away. Guess what? This patient literally refused chemotherapy surgery. I did another colonoscopy on her. Her tumor was bigger. So, that's a problem too. People refuse medicines when medicines are warranted. So that where's the balance? I always tell my patients, eat a whole food plant based to prevent disease and reverse disease and keep disease at bay. But you need medicine sometimes. And the way I do it is, for example, if they have type 2 diabetes, non-alcoholic fatty liver disease, hypertension, hypercholesterolemia, metabolic syndrome in general, and if they are obese, I say, listen, if you lose the weight, we won't need to start all these medicines. What do you say? Let's do 6 months of lifestyle modifications. And that really works because people are motivated.
Right.
to reduce their disease, and they come in and their hemoglobin A1C goes from 10 to 5, and they're like, yay, that's important. And their reflux disease goes away. It's just so rewarding.
Yeah, in my own experience, I didn't want to use any diabetic medications. I refused to, and to some degree, it was good because it motivated me to do the diet fix. But at the same time, when I was trying to transition to a high carb diet, I would get these blood sugar spikes, and I suddenly realized, you know what, I could use a bit of metformin just to help with this transition period, and it just made it a bit easier. I don't really like medication, but in that instance, it's relatively safe profile, and it did mitigate spikes and allowed me to continue on the plant-based diet. So I do think at certain times it's useful.
Absolutely. Look, this is not a race to heaven with whoever's on the least number of medicines. Okay. We gotta use medicines when medicines are important, and use diet for prevention and reversing of disease, but food cannot be medicine. And this is a very important thing, because I even used to walk around going, oh, let food be the medicine. No, that's wrong. And I now realize what I was saying is right. And you know what? It's all about evolving, right? You can't be stubborn. We have to evolve as vegans, and we have to make sure that people know that a whole food plant-based diet is an amazing diet to prevent heart disease, colon cancer, all kinds of diseases. But listen to your doctor. If you're not getting better with a whole food plant-based diet, if, for example, a lot of type 1 diabetics that don't want to use medication, like, you can't do that. Type 1 diabetes is different from type 2 diabetes. Type 2 diabetes is a disease of insulin resistance, and when you lose weight, you can reverse it, but you can't reverse type 1 diabetes. I don't care how vegan you are, you're going to need insulin.
Yeah, exactly. So just to kind of wrap up a bit here, what do you think is the minimum change that a person should make who isn't yet sick? So people who are watching this, they don't have anything really that's like pressing, and they're still indulging in an animal-based diet. What would be like the minimum, easiest change that they can make to at least improve their odds of not getting sick?
Well, you know what? I always tell people, just stop eating dairy, right? Dairy is the biggest junk food sold as health food in this country, right? Lactose intolerance is rampant. 65% of the population has lactose intolerance, and they get gas and bloating and burping and belching and flatulence and distension and diarrhea and constipation. Yet everyone's eating dairy. I don't get that, but whatever. 2% of the population have IgE mediated allergic reactions to dairy. Kids are dying from asthma due to dairy. I mean, so let's all freaking agree that dairy is junk food and get over it, okay? It's like, if you want to eat junk food, fine, but don't call it health food, right? You want calcium,
Right.
great. That's not the only food that has calcium, okay? So it's like really bad for you. So stop eating the dairy.
I've never
You know,
I've never heard anyone call dairy junk food, and it really feels appropriate.
Yeah, and some people, but it has, I eat kefir, or I eat like yogurt because it has, it has those probiotics. Stop eating junk food. It's junk food. Don't eat dairy. I mean, there's no reason you should eat dairy for anything. Okay. Then we talk about red meat, uh, or like process. Let's talk about processed meats. Processed meats cause colon cancer. The World Health Organization has deemed them a carcinogen. Like, for example, like cigarette smoking is a carcinogen, causes lung cancer. Processed meats cause colon cancer, the second biggest cancer in both men and women in the United States. So stop eating processed foods. Processed meats, like cured meats, smoked meats, great. Okay, we got that. Then, if you're smart and you graduate from that, then I would take you to the next level. I say, all right, stop eating the red meat. Why? Because well, where do I begin? There is an association. Now, association is not causation, but large populational studies have associated red meat with colon cancer. So, and it has cholesterol and saturated fat, not very heart healthy. Stop eating the red meat. Then what I do is what I also do is teach them the healthy plate. If you're eating meat, make sure that it's a very small percentage of the plate, about 25% of the plate. and then start like twice or three times a week, instead of meat, eat wildwood tofu. It's hard tofu, and it has the consistency of chicken. So people who've never eaten tofu and they're afraid of, literally there are people who have like never had tofu and they're like, oh, I'm afraid to taste that. I'm like, really? It's so delicious, you know? It's like, you know, you get them to eat these like marinated tofus, and you get them to fry it so it's like a little hardened on the outside and crispy. It's so delicious. I'm like, just replace that chicken or fish couple of times a week, eat the tofu. And you know, they do so much better. They feel so much better. They lose weight. They reverse disease, you know, I get closer to being fired as a doctor. We're healing
Finally,
ourselves.
I'm all about promoting good food. What was it called? Wild blue.
Wildwood tofu.
Got it.
So it is the
Okay.
best tofu on earth. I swear, it's like, and it doesn't stick to the pan. You know those soft tofus, they stick to the pan, and then you like look, it looks like scrambled eggs. So what I do is I take a non-stick pan and I spray a little bit of avocado oil, and I chop up the wildwood tofu to like little pieces, and in particular I like the savory kind, not the teriyaki one, the savory.
I'm getting hungry now. Okay. And how can people get in touch? Talk about promotion. How can people get in touch with you? How can they follow you? What's your social media
Yeah, no, it's
website?
my pleasure. If anybody needs any advice on gut health, I'm a gastroenterologist, board certified gastroenterologist. You can call my office, go on my website, at opbm.com, call my office, make an appointment. I bill Medicare and PPO insurances, and it would be my pleasure. I also do weight loss.
Amazing. Look, I could talk to you for hours. It's been an absolute pleasure. Thank you for coming on the show. And yeah, I hope you get fired more often.
I hope so too. I hope so too. I love that. And it's been a pleasure talking to you. You are such a delight and such a good person. I can tell you're very kind, and I've really enjoyed talking to you, Joe.
Thank you very much. It's been my pleasure.